The power of pelvic floor muscles. Strengthen your inner muscles. Convenient use. Effective treatment. Visible results. Features an innovative and non-invasive biofeedback system that enables Kegel exercises even when fully clothed. 퓨런헬스케어 H&J 7000. As they are not commonly used in daily life, pelvic floor muscles are quite difficult to recognize or engage correctly. Research shows that over 30% of patients perform these exercises incorrectly. Move with precision through expert-guided, science-based training. Biofeedback therapy that lets you observe and train your muscles in real time delivers exceptional results. There is no need to undress or have a complicated setup. Just simply sit down in your regular clothes and you're ready to begin. This non-invasive approach eliminates the need for probe insertion, ensuring a hygienic experience with minimal infection risk. This allows patients to remain comfortable and focus entirely on their treatment. By observing inner muscle contractions and relaxations live on the monitor, you can maximize the accuracy and effectiveness of each movement. Using a resistance-based training system equivalent to about 10 kilograms of external load, it effectively helps restore muscle strength as if you are working out with dumbbells. This device applies gentle, direct pressure to the pelvic floor area, helping identify and engage deep muscles instantly for accurate training. Each session is 10 minutes long. Experience remarkable results in a short time and regain pelvic health and vitality quickly. From urinary to fecal incontinence to prostate-related urinary dysfunction, overactive bladder, and sexual function improvement. We offer a comprehensive solution suitable for everyone, men and women of all ages. Since 2004, 퓨런헬스케어 has been a leader in the field of non-invasive biofeedback technology. Our expertise and innovation built into the H&J series redefine the standards of pelvic health. Reclaim your confidence and daily comfort. Choose a healthier tomorrow with 퓨런헬스케어 H&J 7000 by your side. Up next, a detailed instructional video on device operation. A detailed instructional video on device operation. Number 1. Device connection and power on. First, connect the power cable to port 1 on the rear panel of the device. Next, insert the round connector of the cable that connects the device to the computer into port 2. Then tighten the fastening screw to securely fix the connector to the device. Connect the USB connector on the opposite end to a USB port on the computer. Then connect the abdominal sensor cable to port 3. Once all connections are completed, turn on the power switch. A connection confirmation sound will be heard when the power is turned on. If you hear this sound, it means the device has been properly connected. Number 2. Program launch and patient management. Next, click the program icon on the desktop to launch the software. For first-time patients, proceed with new registration. ID, name, height, weight, and gender are mandatory fields. Date of birth, phone number, address, and comments are optional and should be entered only if necessary. You may edit patient information using the Edit button. The Delete button permanently removes the selected patient's data. Please note that deleted information cannot be recovered. If there are many patients registered, use the search bar to quickly locate a patient by name or ID. If the Display All Patients Information option in the Settings menu is unchecked, blank mode will be activated and patient information will not be displayed on the screen. In this case, only patient information retrieved through the search function will be displayed. Exercise records that were not properly completed by the patient may be selected and deleted. After selecting the exercise record to be deleted, click the Delete button to delete only the selected record. Please be careful not to confuse this with the Delete button in the Patient List section. Number 3. Overview of exercise modes. This device provides various exercise and measurement modes depending on the intended purpose. Select and proceed with the mode that corresponds to the patient's condition. Number 4. Incontinence. The first incontinence mode is a Kegel exercise program designed to strengthen the pelvic floor muscles through repeated contraction and relaxation. After selecting the mode, press the Start button to begin the exercise. The calibration stage will then proceed automatically. The sensor elevates and applies approximately 10 kilograms of force to the pelvic floor muscles, enabling strong contractions comparable to lifting a 10-kilogram dumbbell. On the training screen, the patient should relax other muscles such as the gluteal and abdominal muscles and focus solely on lifting and contracting the pelvic floor muscles upward. The upper graph displays the level of pelvic floor muscle contraction, while the lower graph indicates abdominal pressure. A higher pelvic floor contraction value and lower abdominal pressure indicate correct exercise performance. The strength value displayed on the right side of the screen quantifies pelvic floor contraction force. A value of 1 kilogram represents the force required to lift 1 liter of water. Duration indicates the contraction time of the pelvic floor muscles within a single screen session. Follow the target graph displayed on the screen and repeat contraction and relaxation with maximum effort. During the first 2 screens, the difficulty level of the target graph is automatically adjusted according to the patient's muscle strength. After the first 2 screens, the intensity may be manually adjusted by increasing the level on the left if the exercise is too easy or decreasing it if it is too difficult. To disable the automatically difficulty adjustment applied during the first 2 screens, uncheck Automatic Level Up in the Settings menu on the main screen. The training duration can be adjusted during the exercise using the button at the bottom of the screen or preset in advance through the Settings menu on the main screen. To temporarily stop the exercise, press the Pause button. To resume, press the Resume button. Upon completion, the exercise results are saved to the database. After the training session ends, the day's results can be reviewed in graph format on the session results screen. To print the results, press the Print button. On the session report screen, changes in muscle strength from the patient's first training session to the present can be viewed in graph format. You may select and display only the desired metrics such as maximum strength, average strength, abdominal pressure, and contraction hold time. Unnecessary items can be deselected and excluded from the screen. Results may be printed using the Print button. By clicking the vertical grid line corresponding to a specific date on the graph, you can navigate to the session results screen for that date to review detailed exercise records. Number 5. Contraction Test. The contraction test mode is an assessment function that simply measures the pelvic floor condition of a new patient over a 3-minute period. When the mode is initiated, the patient performs repeated contraction and relaxation of the pelvic floor muscles for approximately 3 minutes across 6 screens. Number 6. Constipation. The constipation mode is designed to assist patients with constipation in facilitating bowel movements. This mode trains the patient to apply abdominal pressure to push stool downward while relaxing the sphincter muscles. After selecting the mode, press the Start button to begin the exercise. The calibration stage will then proceed automatically. The sensor rises to elevate the pelvic floor muscles once, then lowers and stops at a position slightly separated from the pelvic floor muscles. On the constipation mode screen, the patient practices pushing downward using abdominal force while relaxing the sphincter muscles. On the upper pelvic floor graph, the indicator moves further downward as greater abdominal force is applied and the sphincter muscle is more effectively relaxed. On the lower abdominal pressure graph, the indicator rises as more abdominal force is applied. During the first two screens, the target graph difficulty is automatically adjusted according to the patient's performance level. After the first two screens, the exercise difficulty can be manually adjusted using the vertical level control on the left side of the screen. Increase the level if the exercise is too easy, or decrease it if it is too difficult. The total training time can be adjusted during the session using the Training Time button at the bottom of the screen or preset in advance through the Settings menu on the main screen. To temporarily pause the exercise, press the Pause button. To resume, press the Resume button. Upon completion, the exercise results are saved to the database. Number 7. Settings. Press the Settings button on the main screen to access the Settings menu. Session time sets the total duration of the exercise session. Rest time sets the rest interval during the session. Weight offset controls the force applied by the sensor when elevating the pelvic floor muscles, helping to reduce patient discomfort or pain. Hospital name should be entered only if necessary. The COM port is automatically detected upon device connection. When Level Up pop-up is enabled, a notification will appear when the patient's muscle strength exceeds the target level. When background voice guidance is enabled, audio instructions explaining the screen functions will be provided. When Display All Patients Information is enabled, all registered patients are displayed. When disabled, only searched patients are shown. When Automatic Level Up is enabled, difficulty is automatically adjusted during the initial stages. When Pound-Inch is enabled, the measurement units are changed accordingly. When Voice Action Guidance is enabled, motivational voice prompts are provided during exercise. Initialize resets the program in the event of a system error and must be executed only when the device is in an unloaded state. Number 8. Troubleshooting. Number 8-1. Power malfunction. When the power switch on the rear of the device is turned on, a startup sound should be heard. For the HNJ 7000 model, the rear cooling fan should also operate simultaneously. If no startup sound is heard or the fan does not operate, first check whether the power cable is properly connected and whether the power switch is turned on. A significant portion of service requests are related to power connection issues. Number 8-2. Initialize. Resetting in case of sensor malfunction. In the Settings menu on the main screen, press the Initialize button. The sensor will move up and down, a startup sound will be emitted, and a completion pop-up message will appear. After confirming, click Save to return to the main screen. The program will be reset to factory default settings, which may resolve system errors. Please note that the sensor value will also be recalibrated to 0. Therefore, this function must be executed only when the chair is in an unloaded state with no one seated. Initialize is the primary troubleshooting step to attempt in the event of system malfunction. Number 8-3. When the Cannot Find COM port pop-up appears. First, confirm that the power switch is turned on. Try connecting the USB connector to a different USB port on the computer and ensure that the connector is securely fastened. If communication is still not established, disconnect and reconnect the connector at the rear of the chair-type main unit. If the issue persists, the communication cable may be defective. Please contact the supplier or authorized service center. Number 8-4. When the progress bar stops during training. First, execute the initialize function from the settings window. If the issue remains unresolved, right-click the Windows icon at the bottom of the desktop and navigate to Settings, Windows Update to confirm that Windows updates have been completed. Pending Windows updates may affect program performance. If the problem persists, please contact the supplier or authorized service center. Number 8-5. When abdominal pressure measurement is not functioning properly. First, verify that the abdominal sensor cable is properly connected to the rear connector of the main unit. Start the device and, on the training screen, press the abdominal sensor by hand. If the abdominal pressure graph does not rise or shows no response, the abdominal sensor may be malfunctioning. In such cases, please contact the supplier or authorized service center. Number 8-6. When pelvic floor contraction is not measured properly. First, run the initialize function in the settings window to reset the device. Then start the device and press the sensor by hand to check whether the graph responds. If the graph does not respond at all, the sensor may be defective. Please contact the supplier or the service center. If the graph responds normally, the issue may not be with the device but rather with the seating position or exercise technique. The user must sit with the perineal area properly positioned directly above the center sensor of the chair. During exercise, all other muscle groups, such as the gluteal and abdominal muscles, should remain relaxed with force applied only to the pelvic floor muscles for correct Kegel performance. If other muscle groups are engaged, pelvic floor contractions may not be accurately detected. Number 8-7. When the sensor does not rise and the monitor screen does not progress after pressing Start. If the sensor does not rise or the monitor screen does not progress after pressing Start, please check the following basic items. First, confirm that the power switch is turned on. If there is no issue with the power supply, execute the initialize function in the settings window to reset the device. Additionally, verify that the communication cable connecting the device and the computer is properly connected. If the issue persists after completing all of the above checks, the device may be malfunctioning. Please contact the supplier or the authorized service center.